Welcome to Lecto. Today we are going to discuss pressure volume curve. Before we start pressure volume curve, we will revise the cardiac cycle. In the cardiac cycle, you will see four most important phases. Diastole, in which you will see the relaxation of the heart muscle. That's simple. Then after that, you will see the isovolumic contraction, in which the volume will remain the same, but you will see the contractions of the heart muscle. Then you will see this systole, in which you will see the contractions of the muscle. And fourth last is the isovolumic relaxation, in which the heart muscles will relax but the volume will remain the same. So these are basically the four phases of the cardiac cycle. So if you see here, like diastole, isovolumic contraction, systole and isovolumic relaxation. Okay, now if we discuss the pressure volume curve, we will discuss specifically the left ventricle. Okay, here is the left ventricle of the heart. We will discuss left ventricle. Right ventricle will also form the similar curve. Okay, but you will see the variation in the pressure and the volume compared to the right ventricle. Okay, if you see, we will take pressure, intraventricular pressure, that is actually exert inside the ventricle on the y-axis. So here are basically the pressure that is intraventricular pressure of left ventricle, and we will take it in millimeter mercury. That is the unit of the pressure, millimeter mercury. Okay, this is the one thing. Second thing, we will take volume on the x-axis. So on the x-axis you see the volume, ventricular volume. Okay, and that volume will be the milliliter. So here are basically we take the pressure on y-axis and volume on x-axis. Okay, x-axis. Okay, first of all, if we discuss when the left ventricle in relaxed state, it's mean in diastolic state. It's mean that in the diastolic state of the left ventricle, small amount of the blood is already present in the left ventricle. And what amount of the blood that is actually present in the left ventricle, that will be the 50 ml blood present in the left ventricle. And when left ventricle is in diastolic relaxed state. Okay, this is the one thing. So if we think that the here is the 50 ml, this is actually the 50 ml. Okay, that is already present in the left ventricle, and the pressure during this phase will be the 2 to 3 millimeter mercury. Okay, so pressure will be the 2 to 3 millimeter mercury in this phase, in the diastolic phase. Okay, after that you will see the blood from the left atrium start moving into the left ventricle. When the mitral valve open, blood start flowing from left atrium into the left ventricle. So it's mean that at this state you will see the opening of the mitral valve. So this is the point at mitral valve open at this point. Okay, this is the one thing. Okay, when the mitral valve open, blood start moving into the left ventricle. It means the volume start increasing in the left ventricle. So if we see here like this way, the volume of the blood start increasing. Here is the 70 ml, 90 ml, and it will goes towards the 120 ml. So it's mean that the blood will goes towards 120. So it's mean that the 70 ml blood enters from the atrium into the ventricle. So total will be the 120. Total will be the 120 ml. This is the one thing. First thing, already 50 ml is present in the left ventricle during the diastolic phase. After that, the 70 ml from the atrium moves into the ventricle. The total will be the 120 ml. This is the one thing. So if you see here, like this way, this is the 20 ml blood now present in the left ventricle. And during this phase, at the starting point when you will see the volume is 50 ml, at this point the pressure will be the 2 millimeter mercury. And after that, with the passage of time, when the blood starts moving, then you see the pressure starts increasing. So what amount of the pressure will increase? The pressure will goes to 5 to 7 millimeter mercury. This is the second thing. Or you can say this way. The pressure starts increasing and goes towards 5 millimeter mercury. This is the second thing. Okay. Now this is actually the process which happens during the diastolic phase of the left ventricle. Okay. After that, we have discussed after the diastolic phase, we see the isovolumic contraction. This is the second phase of the cardiac cycle. So after that, it means the volume will remain the same. So in this phase, you will see the volume will remain the 120. Volume will remain the 120 in the left ventricle. This is the one thing. That's why we call isovolumic, same volume. But the pressure starts increasing because the muscles of the left ventricle start contracting inwards. So exert pressure inward. So this is the case. Now due to the exertions of the pressure inside, the pressure increase in the left ventricle, and that's why it will increase up to the 80 millimeter mercury. That is the 80 millimeter mercury. Okay. The important point is that at the starting point, mitral valve was open. But during the isovolumic contraction, the mitral valve will be closed, because whenever the pressure start increasing, there may be chances of the blood moving back towards the atrium. So that's why during the isovolumic contraction, both the valves will remain the closed. So it's mean that during this phase, the mitral valve, which has been opened at the starting point, will now close. And in this phase, you will see the isovolumic. This is actually the isovolumic contraction. And we discussed this is the diastolic phase. Okay. Up till now, we discussed the two phases. Next phase is the systole, in which you will see the contraction of the left ventricle. So in this phase, when the left ventricle contract, okay, and in this case, you will see the aorta. The valve, aortic valve will open and the blood rush into the aorta. So in this phase, the blood, the pressure in the left ventricle starts increasing. Okay, and it will go towards 120 millimeter mercury. Okay, because the pressure in the left ventricle must be equal or greater to the aortic valve, so that the blood, keep remember that the blood or anything move from high pressure to the low pressure. So it's mean that the pressure in the left ventricle goes towards 120 millimeter mercury and blood starts moving into the aorta. And after that, what will happen? After that, when this systolic, during this systolic phase, the blood pressure start decreasing. Okay, when the pressure starts decreasing in the left ventricle, okay, and it goes towards the 100 millimeter mercury, then what will happen? This volume 70 ml will release from the left ventricle and goes towards the aorta, and the remaining will be the 50 ml. So it's mean that the remaining blood in the left ventricle will be the again 50 ml. This is the case. Okay. And after that you see in this case at this phase after the isovolumic contraction you see the systole. And during the systole you see at this point you will see the opening of the aorta. And now this point you will see the aorta become closed, because we have discussed that in the isovolumic contraction and in the isovolumic relaxation both the valve will remain the closed. So this is actually the phase in which the isovolumic relaxation, in which the muscles, left ventricle muscles start relaxing, but the volume will remain the same. And in the isovolumic you will see the volume will again the 50 ml. So this is the phase. And in this case you will see again the, after that you will see the isovolumic, after the isovolumic relaxation it will go toward the diastole, and before moving into the diastole the mitral valve open and the blood start moving inward. So this is actually the whole process. So important thing is that you just notice that the 70 ml enter into the left ventricle and 70 ml release into the aorta. So a stroke volume, actually the amount of the volume that is released from the left ventricle in one heartbeat, that is actually the stroke volume. So it's mean that that curve will show the stroke volume. So actually the highest will be the 120 and that is the 50. So if we minus 120 minus 50, then that will be the 70 ml. So it means that the length of the loop will show the stroke volume. Okay. And the area. So important thing, the area that is covered by this loop, volume patch loop, shows the external work output. So this is actually the external work output of the left ventricle, or you can say stroke work output. So this is the important thing. And the last is the most important. When you see the large amount of the blood enter and the large amount of the blood release from the left ventricle, so it's mean when you will see the large volume enter and large volume release, then the size of the loop will increase. So if I say that here is the size of the loop, and after that you will see the size of the loops will starts increasing. Why? Because if you see that in this case, after that you will see the volume size of the loop increase, because large amount of the blood enter and large amount of the pressure exert, and after that release from the left ventricle. So it's mean that the size of the loop starts increasing when the large amount of the blood enter and the large amount of the blood release from the left ventricle. So this is all about the pressure volume loop. That is actually you will see in the cardiac work output. So this is all about the loop. If you have any question you may ask in the comment section. Thank you so much.